Hello, good morning. Welcome back again. This is your acute dialysis nurse, and for today's lecture is about basic chemistry of body fluids and electrolytes. So let's define some terms. First is dialysis. So what does dialysis means? It's about filtration and clearance. So it filters or it clears the blood from any toxins like the BUN, creatinine, potassium, and some drugs. Next is solution. So if we say solution, this is a mixture of dissolved particles. So if we said particles, these are solutes and a liquid. So solute plus solvent. So these are the homogeneous mixture of dissolved particles, which are the solute, and liquid, which is the solvent. So if you say homogeneous mixture, meaning they are the same or alike, which they can be mixed together. So to give you an example is a normal saline solution. This one has 0.9 grams of sodium chloride in 100 ml water. So this is your solute, 0.9 grams of sodium chloride, and this is your solvent, it's 100 ml per water. So normal saline solution is a solution which is a mixture of 9.9 grams sodium of sodium chloride, that will be our solute, and then 100 ml of water, that would be our solvent. Next, how to measure concentration of solution. So concentration of solution. So first is non-ionized. These are weight of solute. So weight of solute per volume of solvent. To give an example, it's milligrams per deciliter. So milligram is the weight of solute, and then deciliter is the volume of solvent. And then ionized, these are molarity and normality, relative number of particles present in their and their charges. So relative number of particles and their charges. So ionized, relative number of particles and their charges. So example, max milliequivalent per liter. Okay, so moving on is electrolytes. Electrolytes are substances that dissolve in water to form ionized particles. So these are ionized particles. Example, we have your potassium, sodium, calcium. So these are electrolytes. They are substances that dissolve in water to form ionized particles. And then we have here ion. What's an ion? These are particles that has an electric charge. Again, ion, these are particles that has an electric charge. Now, they can be an atom, charged atom, or charged compound. So charged atom sample is the sodium, and then this one is sample is the lactate ion. So single compound. Okay, so next let's remove this. We'll discuss about conductivity. Conductivity. So this is very important in dialysis because we measure conductivity of our dialysate solution. So conductivity, ability of solution to conduct electricity. Again, conductivity is ability of solution to conduct electricity. Now we measure conductivity. We measured this one for the correct proportion, concentration of electrolytes and water. So conductivity measures correct proportion, concentration of electrolyte and water. This one is called, this is our dialysate. Conductivity is the ability of solution to conduct electricity, and then conductivity in dialysis measures correct proportion, concentration of electrolyte and water. So that would be our dialysate. So the conductivity in our dialysis and during dialysis is mainly affected by the sodium. So if we go up with the sodium, conductivity goes up. If we go down with the sodium, conductivity goes down. Now, what's the normal conductivity of our dialysate? Now, the normal conductivity of dialysate is 13.5 to 15 millisiemens per centimeter. Now, there's a leeway. So if it should be plus or minus 0.4 millisiemens per centimeter. Your theoretical conductivity is 14 again, and then your meter is 13.8. Is that acceptable? Is this acceptable? So you do the math, 13.8 plus 0.4, it's 14.2, plus minus 0.4 is 13.4. So this is acceptable because it's 14.2, so the theoretical conductivity is 14, so it's within range. So that's acceptable. Okay, so that's how you check the conductivity of your dialysate. The conductivity on dialysis is mainly affected by sodium. Okay, so let's say your conductivity is high, meaning you have high sodium on your dialysate. So you bump the sodium up, and then you have a high sodium. So what happens? So there's high sodium in dialysate, and then it's higher than the blood. So lower in the blood. So what happens? So remember, during dialysis, the mechanism, the principle is through diffusion. So solute from higher, solute concentration goes to an area wherein there is a lower solute concentration. So if the sodium from the dialysate goes to the blood, you have now a high sodium in the blood. So what happens there? If you have high sodium in the blood, it means the normal response of the body, it pulls fluid from the cell. So this is your cell. It pulls fluid out so that it will dilute the high sodium. This is the sodium. So it pulls fluid out from the cell so that it will dilute the sodium on the blood. So what instead of the cell size like that, it will shrink. So that's called cell crenation. So it will shrink. So what happens? So what? So what if there's high sodium, high blood volume? So you have high sodium. Now the blood body pulled fluid in your cells. So the result is high blood volume. So if you have high blood volume, this will cause hypertension, high in BP. So you have high salt. So definitely you'll be feeling thirsty. So profound thirst and headache because you have high blood pressure. So this will goes together. Profound thirst, you drink a lot of water, again increase blood volume, so it goes around. So that's what happens if you have high sodium in your dialysate. Okay, what if you have low sodium in your dialysate? Low sodium, let's say low sodium in dialysate. Okay, low sodium. And then high sodium in the blood. It means the sodium in the blood is higher than the dialysate. Again, this is your semi-permeable membrane, by the way, sorry. Again, area of higher concentration, diffusion, to area of lower solute concentration. So that's what diffusion means. So when you're doing dialysis, diffusion happens, low sodium in the blood. So they have high sodium now in the dialysate. And then it causes low sodium in the blood because the sodium in the blood went to the area of lower concentration, whereas in the dialysate in the blood. Okay, so what? So what if it's low sodium in the blood? What happened? So the normal response of the body, because it has high sodium, it's too much diluted. So the body will push back the water into the cell. So it will push back fluid into the cell. Remember, when we have high sodium, it causes cell crenation. But if we have low sodium, it push back the fluid into the cell. It will cause cell swelling. The cells swell. What happened? This can rupture. It can cause hemolysis. So there you go. So cell rupture, hemolysis. So what are the symptoms if you have low sodium in the blood? If you have low sodium in the blood because the fluid was pushed into the cells, so you have low blood volume, low blood volume leads to hypotension. So low BP. Hypotension. So cramps and hemolysis from rupture. So again, low sodium in dialysate, the sodium in the blood diffuse into the dialysate, causing low sodium in the blood. Now the response of the body, they push back the cell, they push back the fluid into the cell to normalize fluid in the blood, to normalize sodium in the blood. And then too much fluid in the cell causes cell swelling. So, and then low fluid in the low blood volume causes hypotension, cramping, and hemolysis from cell swelling. That's it. So sodium is very important in the dialysis. So whatever was ordered, make sure you put the correct sodium level, because it can cause different kinds of problems when you're messing with when you're messing with it. Okay. So we discussed already diffusion. Next term is diffusion. So again, solute. So this is my clue for you guys. If you're having a hard time remembering the word diffusion, You just say the word, it's going down. It's going down. The diffusion, D, going down. It's going down. So solute, higher solute concentration, it's going down to lower solute concentration until it's all normal. So to give you an example, so this is your blood. This is the semi-permeable membrane. This is your blood compartment. This is your dialysate compartment. This is your fluid. So in your blood, you have a lot of dirty toxins, a lot of dirty solutes. So through diffusion, this is your semi-permeable again, dialysate compartment. So through diffusion, the solute from higher to lower until it normalizes. That's it. So the solute, this is the term, solute is the one that moves, going down from higher to lower. Okay? And then next is, we'll put it here, osmosis. So this one is the water or the fluid. The fluid moves. This one, diffusion is solute, osmosis, fluid. So fluid moves. So this one, I'll give you the, if you're having a hard time remembering, so O, imagine that is you. O, up, up. It's going up, it's going up, or it's going up. So that's your term. If in case you're having a hard time remembering it, it's going the diffusion down, osmosis is going up. So from lower solute to higher solute. Okay, so osmosis is movement of fluid. Fluid moves from, osmosis is fluid moves from lower solute concentration to higher solute concentration until it's normalized. So up, oh, up, or up. That's your clue. So when you're having a hard time, let's give you an example. So this is your blood, this is your dialysate compartment, blood compartment, this is your semi-permeable membrane. This is your fluid. Okay. So this is clean and this is very dirty. So what happened? So the fluid moves from lower solute concentration to higher solute concentration until it's normalized. So you see, the water moves there until it's normalized, and then the solute is also normalized. So there's movement of water. This one, there's no movement of water, it's just solute. Okay. So I hope you get it. Diffusion, D, going down. Osmosis, up, going up. Next word is pH. So pH is power of hydrogen, potential or power of hydrogen. So pH defines the acidity or alkalinity of substance. So the blood normally has pH of 7.35 to 7.45. Now, why is this important during dialysis? Because in dialysis we give bicarbonate. I mean, we don't give it, but there's we in the set in the dialysate there's bicarbonate in it, and bicarbonate, if we give too much, it will either cause the blood pH to go normal or to go up, which is going to be alkaline, because if too much bicarbonate, it's going to be alkaline. If it's low bicarbonate, it's going to be acidic. So like when you're doing dialysis that has a severe metabolic acidosis, they the bicarbonate, they try to go up to 40 just to give bicarbonate in the blood. The bicarbonate will diffuse into the blood to normalize the blood pH. Okay. So what's the the acceptable range for pH during for the dialysate pH, dialysate? So we use the strips to measure this dialysate pH. So it depends on different company, but it can go to 6.8 to 7.8. So usually that's the normal range for dialysate. Now, if it's too low, it means it's acidic. If it's too high, it's basic or alkaline. So if it's too high, it means you're giving too much bicarbonate. If it's low, then you're pulling the patient's bicarbonate. So you check this. We always check this before starting the dialysis. Okay, so next is buffers. We're still on pH. Buffers, what are the two buffers? Kidney and lungs. So for kidney, the major buffer on the kidney is the bicarbonate. So if the blood, if is too much acidic, meaning if you have metabolic acidosis, the kidneys keep bicarbonate. Kidneys keep bicarb and waste hydrogen. Metabolic acidosis, kidneys keep bicarbonate and waste hydrogen. Metabolic alkalosis is reversed. The kidneys will discard bicarbonate and will keep hydrogen. How about for the lungs? So the major component of the lungs that the major buffer system of the lungs is the CO2. So let's start first with respiratory. So respiratory acidosis. So if you have a respiratory acidosis, you will blow off the lungs, blow off CO2. So what does that mean? The patient tends to breathe faster, hyperventilate. Or if they're in the machine, they increase the respiratory just to blow off the excess CO2, because CO2 is acidic. How about if it's respiratory alkalosis? So if it's respiratory alkalosis, the lungs will keep CO2. So what does that mean? They will hypoventilate just to keep the extra CO2 in the blood. Acid and base, so we have to define this. So acid, this can dedonate hydrogen ion, and then base, they accept hydrogen ion. There you go. Okay, we're all done with pH. Next is body water. So for infant, they have 80% body water. Adult male, they have 60% body water. And then adult female, they have 50% body water. So water in cells. What does water in cell do? The water in cells, these are medium for chemical processes. So they surround and bathe the cells. So medium for chemical processes. They surround and bathe all cells. And of course, they serve our transport mechanism. So they're vehicle for nutrient transport from and waste to the outside environment. So vehicle for nutrient transport into the cell, and then vehicle for waste transport out to the outside environment or out from the cell. Okay, so let's go with body water compartment. Body water compartment, ICF stands for uh, intracellular fluid. It composed of 40% of body compartment, or approximately 28 liters. And extracellular fluid, this is outside the cell, 20% of body water compartment, approximately 14 liters. Now this can be subdivided into interstitial, intravascular, and transcellular. Interstitial is outside your blood. It's in the tissues. And then intravascular is inside your blood. Transcellular, these are in between your spaces, like your synovial fluid, pericardial fluid, pericardiac fluid, and in your eyes, intraocular, and in between your lungs, the lung spaces, pleural. So those kind of stuff. Okay, so we're all done with this one. So next we will discuss Starling effect. We will define Starling effect. So the Starling effect is the balance of water in between plasma and interstitial compartment. So this is in between your intravascular and interstitial, between plasma and interstitial compartment. This is compartment. Depends on pressures. Depends on pressures, such as your COP, IBP, and TTP. So Starling effect, balance of water in between plasma and interstitial compartment depend on pressures such as your colloidal osmotic pressure, intercapillary blood pressure, and tissue turgor pressure. So if your colloidal osmotic pressure is normal or high, So it will keep the fluid in your plasma inside the intravascular. It doesn't go to the interstitial spaces. So this one is mostly albumin. So if you have low albumin, you're gonna have low colloidal osmotic pressure. So the fluid from intravascular seeps to the interstitial compartment. How about your intercapillary blood pressure? So if you have high blood pressure, it will push fluid, high blood pressure, it will push fluid from IVC, intravascular, to interstitial compartment. Tissue turgor pressure. So if you have low tissue turgor pressure, this is a sign of dehydration. Dehydration. So your cells are losing its elasticity. They're losing its elasticity to hold the water. So these are signs of dehydration. Okay, we're done with Starling effect. So non-electrolytes in the blood. So what are the non-electrolytes in the blood, in the body fluids? So these are non-electrolytes. Example, we have glucose, BUN, creatinine, and we have also some amino acid, nutrients, those kind of stuff. Normal fluid balance in adult. So intake, then output. So fluid, water from oxidation, solid food, okay. So normal fluid balance in adults. So fluid intake is approximately 1200 ml. Water from oxidation 300 ml. And then solid food is approximately 1000 ml, which is 2.5 liters. For output, feces approximately is 100 ml, urine 1500 ml, and through the skin is 900 ml, which is 2.5 liters. So there you go. Normal fluid balance in adult. Okay, so lastly, we will discuss USG, urine specific gravity. Urine specific gravity, it measures concentration of solutes in urine. So concentration of solutes in urine. So urine is slightly denser than water. Normal value of USG is 1.045 to 1.03 or 1.010 to 1.020. So that's the normal value for USG, 1.005 to 1.03 or 1.010 to 1.020. So what are the signs? What does the value indicate? So for low USG and high USG. So let's go with low USG. So low USG means you have high water intake. It can also because due to diabetes insipidus, glomerulonephritis, pyelonephritis, aldosteronism, renal failure, and then malignant hypertension. There you go. Low USG, low urine specific gravity, may be due to high water intake, diabetes insipidus, glomerulonephritis, pyelonephritis, aldosteronism, renal failure, or malignant hypertension. How about high urine specific gravity? It can be due to high water loss, shock, diabetes mellitus, syndrome of inappropriate antidiuretic hormone, chronic heart failure or congestive heart failure, renal artery stenosis, meaning there's low supply of blood in the kidneys. So there you go. So we're all done with the lecture 2, topic 2, which is basic chemistry of body fluids and electrolytes. And I hope you learned something today. If you have any comments, tips, suggestions, please click it in the comment box below. And I will see you again in our next video. So thank you so much for watching. Take care.